Welcome to Capitol Update, your review of state government for Friday, October 17th. I'm Teresa Marcinberg. The governor took action this week to try to make sure no Ebola cases reach Florida. Governor Scott briefed the media Friday morning after he met with health and emergency management officials at the Fort Lauderdale Hollywood International Airport. That's where a Frontier Airlines jet made a stop Monday with a Dallas nurse on board who's now hospitalized with Ebola. Earlier this week, the governor asked the Centers for Disease Control to contact every passenger who flew on that jet. That's one of several requests the governor says the CDC has not fulfilled.
The CDC and the federal government have already admitted they have failed to get ahead of the spread of Ebola in Texas. And we aren't going to let that happen in Florida. Today, we're demanding the attention of the CDC and the federal government to ensure we have what we need to be prepared to respond and keep our citizens, our visitors, and all of our first responders and our healthcare providers that would take care of somebody afterwards safe.
This week, Florida asked federal officials to clear more than $7 million in federal funds to buy Ebola preparedness supplies, including high-level protective suits for healthcare workers. Late Friday, that money was approved. He also asked for 30 Ebola test kits and said the state has only received 3. The federal government is screening passengers for travel history and symptoms at 5 airports in other states. The governor is now asking for that screening at Florida airports. And he's ordered the Florida National Guard to set up 2 rapid response teams ready to provide health care services for potential Ebola cases. Also this week, 46 Florida hospitals completed mandatory Ebola training programs for their staffs. All those efforts are designed to stop Ebola by preventing physical contact with anyone who might have it. The Florida Channel's Melissa Cleansing talked to doctors who have experienced fighting Ebola and other virus outbreaks around the world.
This particular situation that we're in now is literally unknown in human history.
Dr. Daniel Van Durme is director of the Center on Global Health at the Florida State University College of Medicine. He says the Ebola virus is a terrifying disease because it kills more than half of the people who get it. He says screening for Ebola at Florida airports is a good idea, even though screening is also supposed to be underway in the Ebola hot zones of West Africa.
I would screen again in Florida. So if you land in Tallahassee or Orlando, it doesn't matter. I would not trust the fact that you were screened in Atlanta and Paris and Liberia. You need to screen again yourself here.
Dr. Julia Weeks has spent years in Africa and helped shut down an Ebola outbreak in the Congo in 1995. She says Florida is unique among the states because it's a global center for travel, so needs to be aggressive about stopping Ebola.
The concern for me, which is hard to not get panicky when you think about it, is you might just have that business person who came in from Europe, or maybe the tourist who's coming in from Tokyo, right? And they haven't gone anywhere near West Africa, but they don't know who the people next to them, where they've been. They don't know where they've been. And that's the scary part. Until we can get folks in West Africa to understand they can't be putting people in the rest of the world at risk.
Both doctors also support the idea of stocking up on Ebola preparedness supplies for hospitals, especially top-level protective suits and gear for healthcare workers. And they say it's important that the equipment reach every hospital in the state, not just the major trauma centers.
Those sorts of setups, yes, you need to have, because when the person shows up, and it may be at some small rural hospital, because they're visiting their relative or whatever, they traveled from, they were exposed to, and they show up there, what do? You know, blow a whistle and everybody run out of the emergency room screaming? No, you need a place where you can put this person in a room and it's safe. The people can take care of them while being appropriately protected and while we're waiting for the results to come back.
They say hospitals are already taking action, getting suits and supplies, putting up signs asking people to tell staff immediately if they've traveled recently to West Africa or had contact with someone who has. And they say information about Ebola needs to get to the public quickly and clearly, that even though the risk of Ebola spreading in the United States is extremely low, no one should be complacent.
Right now, if I had to pick on what's the biggest concern, is people speaking as though they have an absolute answer. Well, no, you have nothing to worry about. There is no way that Ebola could ever come into the U.S. There is nothing that you need to worry about. And that was said by a whole lot of experts just, 2-3 months ago. There's no risks to the people, blah, blah, blah. And say, don't speak in absolute terms.
They say Floridians should pay attention to the Ebola threat without overreacting, and be aware that the more you take care of your own health, nutrition, and fitness, the greater your chance of surviving any virus that comes along. For Capital Update, I'm Melissa Klinzing.